Hi, my name is John Whitman. I'm the Executive Director of the TRECS Institute, a nonprofit dedicated to improving care for seniors and saving money for our healthcare system. TRECS stands for Targeting Revolutionary Elder Care Solutions, and our board strives to identify areas within the care of seniors that are really underaddressed. One of the first major areas we tackle was dental care in nursing homes. So in 2006, the TRECS Institute received a grant from CMS to evaluate oral and dental care services and the availability of those services across America's nursing homes. The TRECS Institute study was quite extensive. It was actually groundbreaking for the time. And we interviewed patients, we interviewed families, nurses' aides, RNs, administrators, regulatory officials, the Medicaid programs, and we were able to determine that the current state of dental care in the nation's 15,000 nursing homes that serve 1.6 million people was poor at best. And again, this was an historical factor, a lot of which was the result of limited or no reimbursement under the Medicaid program for dental care services. In fact, we found that it was so bad that people didn't even complain about it anymore. When you ask people about the current state of dental care, a common response was, yeah, we know it's terrible, but what can you do about it? We found cases of nursing home residents that would have an abscess, and it would take potentially weeks to find a dentist to come into the facility. And in the interim, they put the patient on pain medication. During the course of the study, we did identify one program in Minneapolis that we thought was pretty remarkable, a program called Apple Tree Dental. And this program would have been around for almost 25 years. It was started by dentist Michael Helgeson, who started taking care of nursing home residents regardless of payment. He would go into nursing homes and provide whatever dental care services were needed for that population, regardless of payment source. And for 25 years he did this and generated some excellent data on what was being provided, what was actually needed. And about 7 years ago, a PhD student took Dr. Helgeson's data and did her PhD thesis on it. And that has become, in my opinion, the only legitimate source we have of definitive care needs, dental care needs for nursing home residents. If you look at the statistics from any other state across the country, they're going to give you data that's based on what's paid for as opposed to what's needed. So Dr. Helgeson's research and the data that came out of that service that he provided became the Bible for developing a solution to the current lack of dental care services in nursing homes. The research identified a number of very serious issues in terms of good dental care services in nursing homes. One of the most important was the fact that because a lot of the Medicaid residents prior to entering the nursing home had very little association with professional dental care, they would go 15 or 20 years potentially from the point they retired to when they entered the nursing home with little or no care. So when they entered the nursing home as a resident at age 80, 82, they would walk in the door with a mouthful of problems that the nursing home then inherited and was totally unprepared to care for. We generally found three types of dentists working in the nursing home environment. There was the Good Samaritan population. They were the solid dentists that came in with a mission to serve. Unfortunately, there weren't quite enough of those, but God bless the ones that do that. We also found dentists that were in the nursing home trying to make a profit and trying to make that their business. And under the Medicaid environment, that's very, very difficult to do. And we found a lot of situations where it was next to impossible to find a dentist to come in. We found several examples of residents that would have an abscess, for example, and it might take the facility 2 or 3 weeks to find a local dentist willing to care for that patient, to come into the facility, provide the service, and in the meantime they go on pain medication. The other option was to transport the patient by ambulance with a nurse's aide to the doctor's office, where the facility would end up paying cash to the dentist, pay for the nurse's aide time, and pay for the ambulance. Clearly not an effective way to do business. Another problem we found was that the nurse's aide was the primary caregiver to residents in the nursing home. On their ADL sheets, on their activities for the day, dental care, oral care, brushing of the teeth was not even identified as one of their responsibilities. It was also surprising to find a high level of ageism in the nursing facility. In our interviews with families, it was very common to hear someone respond with, "Of course Mom has bad teeth. She's 87 years old. What do you expect?" One of the positive recommendations that came out of the TRECS Institute study was to develop a private dental insurance program specifically targeting the Medicaid population. Medicaid is about 65 to 70% of most nursing facilities' occupancy, and they're the ones typically with the poorest dental care conditions. The dental insurance product is a mechanism that allows the Medicaid resident to use some of their personal responsibility funds that currently go to the nursing home, to buy private dental insurance. It's allowed under federal law, and then the Medicaid program makes up that difference to the nursing home in the grant that's provided to the patient. The bottom line is the family or the resident sees no additional out-of-pocket expense, and the nursing home is kept absolutely whole. The Medicaid program ultimately pays for this service, but indirectly, because it's an add-on to the grant that goes to the nursing facility. But the advantage is, by having a private dental insurance product, you can bring dentists in, pay them legitimate market rates, and provide an array of services that the nursing home population needs. One of the most unique features was denture care. Historically, dentures take forever to get approved in the Medicaid program, and then take a month or more to develop and make, and therefore you can have a resident go 4, 5, 6 months waiting for a pair of dentures. Under the insurance product, there's programs that allow for dentures in a day, which is just amazing for this population. Since the TRECS Institute report was published in 2006, there's been some dramatic improvement in dental care across nursing homes, but not completely. There's still a lot of gap. Personally, I get very concerned when I hear an administrator or an owner of a nursing home hear the benefits of an insurance product like that, and the ability to raise the dental care services from a really low level historically up to a very high level. And the response will be something like, I'm not hearing complaints about dental care, so I don't think I'm going to do anything. If it's not broke, I'm not going to fix it kind of mentality. The status quo mentality is something that really has to change. Another real concern that we identified was the lack of regulatory citations for poor dental care. And in interviewing a lot of the regulators, the issue is quite clear. They're sympathetic to the fact that nursing homes have very few options in terms of providing dental care services. So the citations have been very limited, unless there's very significant cases of an abscess that goes untreated, for example, for weeks at a time. As dental care improves in nursing homes, particularly as a result of these insurance products, it's hopeful that the regulators will recognize that and help improve the overall standard by citing those facilities that aren't up to a standard that's appropriate for the residents and the needs that they have from a dental and oral care perspective. Historically, dental care in our nation's 15,000 nursing homes has been very poor at best. This was proven out by the TRECS Institute study. The recommendation made to develop private insurance products specifically targeting the Medicaid population will go a long way to improving that level of care. And I would recommend to every facility that if you're not looking at a dental insurance program, you should. This is a way to bring good dentists and good care to the residents that you serve and have the responsibility for caring for. Another real advantage of the dental insurance product is the visits by dental hygienists to work directly with nurses' aides and residents to improve daily care services. The TRECS Institute's research in this area was so enlightening that Medicaid programs have identified a simple funding solution to make this dental insurance product available. If you'd like more information on how to implement such a program in your organization, please give the TRECS Institute a call at area code 484-557-6980 or go to our website at www.trecsinstitute.org. Thank you for your time. The TRECS Institute remains committed to improving oral and dental care services across our nation's nursing homes and to ensuring that best practices are put into place. We'll be continuing to do studies to identify new recommendations to help improve that care even further.